Good day, Professor. I'm Li Yuanhua. Now I'm going to talk about the tuberculosis disease, which is also known as TB. Pneumonologist is the doctor who diagnoses and treats the disease of the respiratory system, which are the lungs and other organs that help in breathing. The well-known pulmonologist in Malaysia is Dr. Kon Kun Siong. He is the specialist in the internal medicine, interventional pulmonology, respiratory medicine. He clinically focuses on COPD and asthma, pneumonia, and lung fibrosis. He completed his study at Royal College of Surgeons from 1998 to 2002. Later, he finished his postgraduate training at MRCP in UK. Besides, he was awarded Anugerah Perkhidmatan Cemerlang 2008 by the Ministry of Health. The lungs is located in the thorax, either side of the mediastinum. Besides, it's above the diaphragm. The main function of the lungs is to oxygenate the blood and then transfer the oxygenated blood to the rest of the body for gaseous exchange. The thoracic wall is designed in segmentum to protect the lungs. It is composed of skeletal elements and muscles. Skeletal elements include osteocartilaginous thoracic cage, while muscles include diaphragm and intercostal muscles. All are helping with breathing mechanisms. The thoracic wall extends between superior and inferior thoracic aperture. Osteocartilaginous thoracic cage helps in protecting thoracic viscera. It consists of thoracic vertebra with the intervertebrates, ribs and costal cartilage and sternum. We have a total 12 thoracic vertebrae. The thoracic vertebrae are joined to ribs by the vertebrocostal joint. The ribs are extended from the thoracic vertebra to the sternum. Muscles of the thorax can alter the size of the thoracic cavity, thus changing the pressure of the thoracic cavity and allow the gaseous exchange to occur. Diaphragm is dome-shaped. It separates thoracic and abdominal cavities. It contracts and flattens to create low pressure in the thoracic cage and allow the air to be pushed into the lungs, vice versa. Internal intercostal helps in elevating the ribs during exhalation to expand thoracic cavity, while internal intercostal draws the adjacent ribs together during forced exhalation to decrease the size of cavity. The organ related to TB is lungs. Lungs is in pyramid shape. It is a paired organ and is connected to the trachea. Trachea is then branched to bronchus, bronchiole, and alveoli. There are two portions of respiratory system, which are conducting portion and respiratory portion. The conducting portion is made up of pseudostratified ciliated columnar epithelium with goblet cell to contain air from atmosphere to lungs and then from lungs to the respiratory portion. The goblet cells of the epithelium helps in secreting the mucus, thus forming the protective layer and trap the microorganisms. The respiratory portion is made of simple squamous epithelium that aids the cellular gaseous exchange. The function of this portion is for gaseous exchange between the alveoli and the body cells. The bronchopulmonary segment is the smallest unit of the lungs. Each lung consists of 10 segments. Let's look at the right lung. According to superior lobe, it consists of apical segment, posterior segment, and anterior segment. Medial lobe consists of the lateral segment and medial segment, while the inferior lobe consists of superior segment, medial basal segment, anterior basal segment, lateral basal segment, and posterior basal segment. Now look at the left lung. Left lung only has two lobes, which are the superior lobe and inferior lobe. Superior lobe consists of epi-posterior segments, which consists of two lobes, anterior segment, superior lingular segment, and inferior lingular segment. The inferior lobe of the left lung actually has the same content with the right lung's inferior lobe. Pleura is a serous membrane. It is made up of simple squamous epithelium. The bilayer pleura consists of parietal pleura and visceral pleura. The main function of the pleura is to cover the lungs, provide a slippery but not sticky surface, and thus allow the expansion and deflation of lungs in the thoracic cavity, while the pleural cavity is the cavity lies between the layers of pleura. The conducting portion of the respiratory tract is supplied by the pulmonary arteries, while the respiratory portion is supplied by bronchial arteries. The phrenic nerve mainly innervates fibrous pericardium, portions of visceral pleura, and diaphragm. Nerve of the pulmonary plexus consists of branches of the vagus nerve and sympathetic fibers. The plexus branches around the pulmonary vasculature and bronchi. Parasympathetic innervation of the pulmonary plexus causes constriction of bronchi, dilation of pulmonary vessels, and increased secretion. For the sympathetic innervation, it causes dilation of bronchi and constriction of pulmonary vessels. There are some differences between right and left lungs. The first difference is the bronchus of right lung are shorter, wider, and more ventricular compared to left lung. The other difference is right lung have 3 lobes while left lung only have 2 lobes. Thus, right lung have 2 fissures while left lung only have 1 fissure. There is also a cardiac notch present on the left lung, so it's said that the left lung is slightly smaller compared to right lungs. The bronchus is divided into 3 parts. The first part is principal bronchus, the second part is lobar bronchus, and the last part is segmental bronchus. The subdividing bronchuses increasing the surface area, thus increasing the rate of gaseous exchange. Alveoli is a specialized air sacs. It is structural and functional unit of the respiratory system. Alveoli is also the gaseous exchange occur. The characteristics of the alveoli are 1 cell thick, rich in blood supply, have moist surface, and have large surface area to aid the gaseous exchange. The lungs allow the gaseous exchange from the environment with the body cells. The alveoli are the site where gaseous exchange occurs. The continuous exchanging gases prevents the accumulation of carbon dioxide inside the body. Since carbon dioxide is acidic, accumulation of carbon dioxide inside the body can lower the blood pH. Thus, it is said that the lungs help in regulating the blood pH. Besides, lungs also allow speaking. Without airflow, a person will not be able to speak. TB is caused by the bacterium Mycobacterium tuberculosis. When an infected person with active TB coughs or sneezes, they release respiratory droplets into the air. These droplets contain the bacteria. Another person can be infected by inhaling these airborne droplets. The bacteria then enter the respiratory system. Once inhaled, the bacteria reach the alveoli. In the alveoli, the bacteria encounter alveolar macrophages. In some cases, the immune response may not completely control the infection. Thus, the bacteria become active and leading to tuberculous pneumonia. Active TB disease is characterized by the destruction of lung tissue and then the formation of cavities, which can contribute to the spread of bacteria and transmission to others. There are 2 types of TB. The first one is pulmonary TB. Pulmonary TB is the most common form of TB and primarily affects the lungs. It can present as either active or latent. The second type of TB is extrapulmonary TB. The bacteria spread to the other organs through the bloodstream or lymphatic system. The common sites are lymph nodes, bones, joints, meninges, and abdomen. The pulmonary TB can present as either active or latent. During the latent periods, individuals are infected with the bacteria but do not exhibit symptoms of active disease. They are not contagious to others. Instead, the bacteria remain dormant and inactive within the body. The latent period of TB can vary widely from person to person. In many cases, latent TB infection can persist for a person's entire lifetime without ever progressing to active TB disease. However, there are instances where latent TB become active, especially in individuals with weakened immune system. The extrapulmonary tuberculosis is bacteria are spread to other organs through the bloodstream. Myocardium tuberculosis can enter the bloodstream when the immune system is unable to contain the infection within the lungs. Once in the bloodstream, The bacteria can be transported to various organs and tissues throughout the body. For example, the lymphatic spread. The lymphatic vessels are part of the body's immune system and play a role in transporting immune cells and fluids. TB can spread through the lymphatic system to lymph nodes and other organs. Tuberculosis can present with a variety of symptoms. Here are some common symptoms. The first one is persistent coughing. The patient may cough for more than 2 weeks and it may be associated with blood. The patient will also experience chest pain. The pain and discomfort in the chest often associated with coughing or breathing. The third symptom is coughing up blood. Besides, persistent fatigue and weakness are common symptoms among patients. Unexplained weight loss is a significant symptom of active TB. This can be a result of decreased appetite and metabolic changes. Patients will also experience fever. Low-grade fever or higher body temperature may occur especially in the afternoon or evening. In latent TB infection, where the bacteria are present but not causing active disease, there are typically no symptoms. Latent TB is not contagious and individuals do not feel the symptoms of extrapulmonary TB vary depending on the affected organs. For example, for tuberculous meningitis, the patient may have the symptoms headache, neck stiffness, and neurological symptoms. For skeletal tuberculosis, a patient may experience joint pain and swelling on their joint. For patients with infected of genitourinary TB, they may experience pain during urination and the blood is occur in the urine. Our Malaysian government has launched National TB Control Program (NTP) in 1961. At that time, the recommended treatment for TB was a combination of 3 drugs, namely streptomycin, isoniazid, and para-aminosalicylic acid. The drugs are given for 2 months, followed by isoniazid and PAS given for 12 months. It is mandatory for patients to go to the hospital to take medicine every day. This is the way the government does to ensure all patients are under monitor and thus can decrease the cases. That's all from me. Thank you.